All right, hello. This is Michael, Sarah, and Larry doing our surgical presentation over anterior cervical discectomy and fusion.
So the background, the cervical spine consists of C1 through C7. The bony anatomy consists of the body, the spinous processes, transverse processes, and the dens for Atlas C1. Other anatomical structures include the intervertebral disc, the spinal cord, vertebral artery, vertebral vein, and then also the facet joints.
So now we're looking at the pathology. Cervical disc herniation is a result of the displacement of the nucleus pulposus of the intervertebral disc, which may result in impingement of these transversing nerves as they exit the neuroforamen or directly compressing the spinal cord contained within the spinal canal. So as indicated right in this picture, you see that compression right there. That's what we're talking about when we're talking about the cervical disc herniation.
So the procedure for this is an anterior cervical discectomy and fusion is a type of neck surgery. This surgery involves the removal of a damaged disc to help decrease the pressure placed on the spinal cord and nerve root. So as seen in this picture, you can see the vertebral bodies and then the discs being removed. And then here we have a link of a video to explain.
Degenerative disease of the cervical intervertebral disc can cause spinal stenosis. Protruding disc tissue can put pressure on the nerves that travel through the spine, which can lead to serious consequences. One of the treatments is anterior cervical discectomy and fusion. A thorough discectomy is performed first to completely eject the disc and release the spinal cord. Vertebral end plates are then prepared to ensure placement of the implant and create a vascularized surface for stimulating fusion. Trials are placed in the cavity between the vertebrae to select the correct implant size. Then, a suitable size implant is inserted with the holder. The central space of the implant is preloaded with a graft. Two curved anchoring plates are inserted through the interior of the holder and implant. Self-retaining plates are immersed in the vertebral bodies and securely fix the implant with the vertebrae in order to provide the stability needed for successful fusion. The implant maintains the spacing of the vertebrae while the fusion takes place. After the fusion is completed, a solid bone mass forms and two vertebrae are joined together.
So implications that can occur during the procedure, the spinal cord is monitored. Post-surgery, the esophagus is also monitored for injury. Patient may experience a sore throat when swallowing post-surgery. Possible neuropraxia, which is traumatic peripheral nerve injury, can occur. Postoperative dysphagia, postoperative hematoma, and recurrent laryngeal nerve palsy can also occur. And also low impact aerobic exercise such as walking, elliptical exercise, and stationary bicycling can be done immediately post-surgery.
Take-home message. So this procedure is used to help relieve the pressure that is placed on the spinal cord or nerve root. It has been reported to be the golden standard when looking at the surgical intervention for cervical disc herniation, and clinical studies have shown that this has the best outcomes and a relatively low when it comes to complication rates after the procedure has been completed.
And here's a list of our references. Thank you.